will the minister manage to sack 3,000 jobs while hiding behind a commissioner without the unions fighting back? Because that's what they're hoping for.
Well, it's galaxy level bullshit on the most basic analysis. So just take the core figures that you've quoted there, $1.3 billion. Now, if the average salary...
I don't mean to interrupt us, obviously, but I really want to highlight how important this part of the conversation is, right? How important it is and what horseshit is coming out from this national-led government.
That you've quoted there, $1.3 billion. Now, if the average salary of a middle manager at Health New Zealand was $200,000, which it won't be, that's 7,000 people. So you can fire 3,000 and you won't even be halfway there. It's just made up stuff. It is just made up stuff. And actually, Aisha Verrall has revealed and confirmed today that actually a lot of the cost that's being dealt with here is around dealing with pay equity and getting the extra nurses in that we need to make the system work.
Right.
So what it is the government underfunding what are actually quite fundamental and basic parts of delivering health services.
Why should voters accept a government who purposely underfunded public health and manufacturer funding crisis? If it's not that Health New Zealand is spending too much, it's because National refused to budget what they are spending.
Well, that's quite right. And what people I need to remember, and I'm sure will remember, is that this was a government led by Christopher Luxon that prior to the election was very clear and stood on many platforms and said that there will be no cuts to any frontline services. We're seeing that in health, we're seeing that in education, we're seeing it with budget services, we're seeing it with food banks, we're seeing it in customs.
And
right
again,
Mr.
Grant's about to come in and show his whole ass.
Those tax cuts, those $14 billion of tax cuts, and that figure's not made up. That's what the government has booked for them, has to be paid somehow. And this is the cost.
So where is the cuts to frontline health and education? Because what you just said, if I'm understanding you correctly, is that this government is cutting doctors, nurses, teachers. Is that what you're saying?
What I've just said is
you
can't cut $1.3 billion out of health without cutting into frontline. And I've just given you the figures as to how you could possibly get there. It's 7,000 people being paid $200,000 a year. There's not that much fat. You could cut all of the middle management out and you'd still have to cut.
But it's because they've underfunded the amount. They've underfunded it.
So it's entirely possible that they're not going to get the level of savings that they want.
Hang on. Now, see, this is the other trick these guys are doing. They're going, okay, I know National's saying this. Let's just accept that this is not what they're going to get. No. The party of business, the party of numbers, the last guys were the guys that got all their numbers wrong. You can't just sit there and go, okay. So let's just say that they're having a guesstimate and they're not going to quite get there. Sorry, Mr. Grant, you don't get to do that whilst you hold the last lot accountable for not knowing their fucking numbers.
So it's entirely possible that they're not going to get the level of savings that they want, right? So they've gone out there and said, we want to save $7 billion, what, blah, blah, blah. But, and like a lot of politics in New Zealand, the announcement is the thing, right? It doesn't matter what we do, it just is what we announce. So I think we can discard what he says.
But you don't bring less.
We just discard what they said.
Mr. Cut the health service down to size and get it ready for commercialisation in the 1990s as someone just to sort of waffle on. He's a guy, whatever you think of them, who's there to do stuff. So I don't quite accept what you've just said.
But at the moment, we have seen no cuts to doctors, no cuts to nurses, no cuts to...
That's such a false argument. It's such a false argument.
But it hasn't happened.
And it's a false argument because you say, they haven't cut the doctor. No. What they haven't done is they haven't afforded and budgeted for an extra doctor to also be there as the population goes up. That's the problem.
Okay.
They haven't funded any of that.
I'll just add one more thing, and I'm sure Craig's got a lot he can add to this. Remember, of course...
It just looks like Craig is starting to boil. Just the way he's moving, it's like, okay, I've got spreadsheets, and I need it now.
One of the things that they didn't do this year, they said they would do is deal to the cancer drugs, and the way that they've then fixed up that political schmozzle has been to pinch money from forward budgets. So this is a problem that will only get worse.
And just in case you missed that pronunciation, because it was a bit garbled, to pinch money from forward budgets from the future. So this is just going to get worse and worse and worse. Now, this is how we run the show, Chewy. I kind of go blah, 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 blah during the clip, and then I shut up and you wrap up. So what would you say about the first clip?
Damien Grant is outclassed.
Yeah, very much so.
He is.
Yep.
He has gone into this fight completely unarmed. He's hiding behind the shield that is his deeply held principles, which is trying to fend off a guy with a sword with your mum's best tea saucer, I guess. It's hilarious. It's indefensible. And I'm here for it. Damien, continue. Please keep doing this.